All right, thank you for joining us. We have Dr. Rajib Choudhury with our cardiology clinic, and I'm going to let him introduce himself, and then we'll go through our questions.
Hi, I'm Rajib Choudhury. I'm a cardiologist. I've been in practice here since 2003. I'm also the medical director of the cardiology clinic, and happy to be here.
Great, thank you. So many hospitals are experiencing a lot fewer patients coming in for healthcare, including emergencies and regular healthcare. Can you tell us what we are experiencing here at Valley, particularly for cardiac patients?
Yeah, we've seen a similar trend as we've seen nationwide. Less people are coming in, both for acute care and for just general health checkups. So we're seeing a similar trend.
And what do you think about why there were fewer patients coming in? We've heard that it might be that some patients are restricting activity, and that maybe they're not having the same cardiac types of symptoms as they've had before. But is it that patients are concerned? What is your opinion on that?
Well, there's two parts here. One is the emergency care, and we've seen decline in both emergency care and routine healthcare. The routine healthcare was partly we shifted resources so that we could take care of the pandemic that we're dealing with. So we cut back on our office staff, and we stopped scheduling a lot of the routine testing and office visits. So that's a different kind of a thing. But we also noticed that emergency care had also declined, and that was a little bit of a concern because we want people who are having serious medical illnesses to get their illnesses taken care of. And it's hard to know exactly why this happened. But one of the concerns that we have is that people were delaying going to the hospital because they were afraid of the COVID infection. And so they were maybe either minimizing their symptoms or just delaying it or toughing it out. There's also a theory that maybe they were not out there as being active, so they were not having some of the symptoms that they would normally have if they were walking or being very active. So those could be some of the reasons, but we'll never really know for sure.
What can you tell us about how Valley is protecting patients and staff there, your cardiology clinic, as well as other patient care areas here at Valley?
Yeah. So Valley has been doing a very incredible job of screening and protecting both patients and their staff. Really, they've got a lot of policies in place, and they're always updating it and changing it to be very current. So currently, all patients, all staff, when they come in, even the visitors, they get screened when they come into the hospital. So there's also universal masking. Both staff and visitors, patients are required to wear masks. Staff are being provided adequate facilities, what we call protection equipment, so that they can do their jobs in a safe way. We're limiting visitors, and I think those are important aspects. Also, physical distancing. So in our office, for example, the lobby, we've set up chairs in a particular way so that there's at least 6 feet distancing between patients. Patients, when they come in, they get checked into the room very quickly. They don't have to hang around with other people, so they can go into a room where they're confined to a private space. So we're taking a lot of precautions of those kind of nature. The rooms are clean in between patients, all the ECG equipment, the countertops, everything's cleaned very regularly. And also in the hospital, I think people forget that the hospital is a big place. And we have a dedicated COVID unit where the people who are actually infected with COVID are located in a particular floor. So when you come in for an echocardiogram or a stress test, you're in a very different part of the hospital, so you're not exposed to COVID patients. So I think there's real fear when you think of the hospital, but that's not the case. I think the hospital has done a very good job. And when you come to the clinic, you're in a completely different building.
Great, thank you. So what are the symptoms of a heart condition or an emergency that patients shouldn't ignore? and help us know, like, when should somebody call 911 versus when should they call in to make an appointment with their cardiologist or with their primary care provider?
Right. So, obviously 911 is a serious emergency when you're having or you're facing a serious emergency, like you think you're having a heart attack, you're getting chest pain, there's very intense pain that's not going away, and you have all the risk factors for heart disease, or you're passing out. People who are passing out or having extreme shortness of breath. Those are emergencies, and you should be calling 911. The other thing is the routine care. For example, a lot of my patients who have heart disease, they have angina, and they have been living with angina, and maybe now they're noticing that when they go up to the mail or they're walking out, taking their walks, they're beginning to develop some of those same symptoms that they were having before. But they're predictable symptoms. They are kind of recognizing that I've had this before. Or, maybe it's a new symptom, but it's coming on with certain activity. That's something you want to call the doctor's office and say, hey, I'm getting these symptoms, so that then somebody will triage them and decide if this is something they need to come in immediately to the office, or can wait or start them on medications. Certainly, those are reasonable to call the office for.
Okay. And does COVID-19 cause any heart-related problems? And why are some patients with a history of cardiac conditions at higher risk?
Yeah. So once you get COVID infection, it initiates a systemic inflammation in the whole body. And this is true for a lot of other viruses too. And a lot of the viral illnesses that we see can cause a condition called a cardiomyopathy, and you can get congestive heart failure. You can get arrhythmias where your heart rhythm goes off sync. So a lot of these things can happen with any viral infection. And so, of course, with COVID. With COVID, it is particularly serious in certain people who are elderly or who already have compromised heart function, for example, who've had congestive heart failure, who've had a heart attack in the past, or they have chronic lung conditions. It just makes it that much harder to fight the virus. So that's why we are more concerned about people who have pre-existing heart conditions, even lung conditions, and the elderly, to be a little bit, they tend to have more severe infection.
Okay. And can patients have a telehealth visit with a cardiologist? And if so, how does that work?
Yeah, this has been an incredible development, and we're seeing more of that. I'm actually on a Zoom platform right now talking to you, and I'm learning more about this. So, I think if I can do it, I think a lot of people can do it. We are beginning to do a lot more telehealth, and that's a virtual face-to-face visit, just like you and I are talking. And it's perfect for somebody who needs just routine care, who's otherwise feeling well and doing well. Maybe they need to come in for an annual visit. They need to get their, just a quick checkup, make sure everything's going well, touch base with their physician, or maybe have some discussion about certain treatment options. Those are perfect visits. I think, or if, the advantage is you don't have to find parking. It saves you, and you don't have to commute, so you save so much time. So certainly I encourage people to look into that too. It's a great resource.
Okay. And obviously there's some types of patient visits that you do have to come in and be seen in person. Can you describe what some of those situations might be? And then also, like, for the diagnostic testing, how to help encourage patients to know that it's really important to get those diagnostic tests done, like an echo or EKG.
Yeah. So obviously, if you're having some concerning symptoms or new symptoms, we might need to examine you. We might have to do an ECG in the office, and those are hard to do remotely. So I think certainly those are somebody we would encourage you to come into the office for. Or if we've never met you before, it's completely new to me. I think it's always good to have a relationship face to face, and also allows us to take a look at you as a whole person, examine you, listen to your chest, listen to your lungs. So that's something I would encourage you to come in for. When we need testing for, for tests, like if we heard a heart murmur, for example, I listen to your chest and I hear a murmur, I might want to do an echocardiogram done. And that's done in the hospital. We set it up, and those are, again, safe to come in to do them. They're, as I mentioned, the hospital, they're masking people, they're cleaning those equipments, they're located in a separate part of the hospital, different from where the COVID patients are. So it's perfectly safe to come in. It only takes half an hour to get an images and you go home. Same with stress tests. If somebody's having chest pain, for example, the next step we might decide to do is do a stress test. And so that's again done in the hospital, but a different section of the hospital where it's very safe to get these tests done.
Great, thank you so much. Do you have any other advice or guidance for our patients who are watching?
Well, I think one of the things that we have noticed is that heart disease is still the leading cause of mortality and morbidity, heart disease and strokes. And so people with heart conditions certainly need to be watched, monitored, and taken care of. And so although COVID is a serious illness, we should not forget that heart disease, strokes, these are still the leading cause of mortality and morbidity.
Great. Well, thank you so much for taking time to talk to us today.
Thank you.